Hello everyone, welcome to another video. I am Dr. Fen, and on this channel we break down complex medical topics into simple science-backed bits of information. There will be a new video every week, and if you are here for the first time, please subscribe to my channel and press the bell icon for notifications. We all know that cancer is a disease that is curable if detected at an early stage, but deadly in the late stages. Young people commonly come to our clinic saying, I had an uncle or an aunt who had cancer, so please do a full body checkup or scan my whole body to see if I have cancer. Are there any tests that can pick up cancer at an early stage? Are these tests actually helpful, or will they just create more anxiety? Today, we will discuss what these screening tests are, whether they are actually worth doing, at what age, and who should be the ones doing it. Let's get into it. Let us start with the screenings backed by strong scientific evidence. These are the tests everyone in a certain age group should be doing, regardless of their family history or lifestyle. Breast cancer is the most common cancer among women across the globe. The best way to detect it is through a mammogram. A mammogram is an X-ray of the breast, very quick, and you get the report in just a few hours. Different countries have different age cutoffs and frequency of doing a mammogram, depending on their health systems. Broadly speaking, mammograms are best started by 40 to 50 years of age and repeated every 2 to 3 years. If there is a suspicious spot on the mammogram, your doctor may recommend a biopsy from that area to confirm cancer. This helps detect breast cancer at an early stage. The surgeon can then remove only that affected part of the breast. Sometimes more toxic treatments like chemotherapy can be avoided if the breast cancer is detected very early. Remember, a breast examination alone, either by yourself or by your doctor, is not enough to detect an early cancer. You need a mammogram. If you have many relatives in your family who had breast or ovarian cancers, you may be having an inherited breast cancer syndrome. In such a case, you are at a higher risk of developing breast cancer, and you need to discuss this with your doctor, as you might need to undergo an MRI of the breast along with a mammogram. Cervix is the lowermost part of the uterus, and cervical cancer is one of the most common cancers among women in developing countries. Many women who come to our cancer clinic with advanced cervical cancer recall having occasional bleeding or white discharge before. Due to the social stigma, they were very shy to visit a doctor and ignored those warning signs. This is a dangerous mistake. There could be many reasons for having irregular bleeding or white discharge, but it is best not to ignore it. Cervical cancer is one of the easiest cancers to prevent due to the excellent screening that we have and the human papillomavirus, the HPV vaccine. The American Cancer Society recommends starting screening by age 25. There are two types of tests. One is a pap smear, which is done every 3 years, and the other is an HPV test, which is done every 5 years. Your gynecologist will be taking a sample from the cervix, and it's done in minutes. So you may ask, I've received my HPV vaccine before. Do I still need to be screened for cervical cancer? And the answer is yes. Why? Because the HPV vaccine protects against some forms of HPV, not all. And that is why it is important to continue screening even if you have received an HPV vaccine before. Cancers in the large intestine and rectum are called colorectal cancers. Many people experience bleeding while passing stools. They are shy to go to a doctor, think that it could be due to hemorrhoids or piles, and they try some home remedies. This is again a bad idea. Colorectal cancer can be diagnosed early with a test called the colonoscopy. The doctor inserts a scope, which is a flexible tube with a camera at one end, through the anal opening to examine the entire length of the colon for suspicious polyps. So, what are these polyps? They are small mushroom-like growths inside the colon. Some are harmless while others may develop into cancer. Only a biopsy can confirm whether it is a normal polyp or an abnormal polyp. A colonoscopy is best started at the age of 45. For most people, it is repeated every 10 years. Some people have a higher risk of colorectal cancer if you had polyps earlier, or if someone in your family had colorectal cancer, or if you have any of the inherited syndromes that can make you more prone for colorectal cancer. In such cases, you need to start colonoscopy early and also do it more frequently. Please discuss this with your doctor. Some people may want to avoid colonoscopy because they find it uncomfortable. Is there any alternative? Now there are stool tests that can check for cancer cells or blood in the stools. But remember, if you get a positive test, you will still need to do a colonoscopy. The advantage of doing a colonoscopy is that if there is a polyp, it can be biopsied as well as removed during the same procedure. Everybody knows that smoking causes lung cancer. Chest x-rays are not recommended as a screening tool for lung cancer. Then what test do we do? The preferred test is a low-dose CT scan, which uses lesser radiation than a conventional CT scan. But does someone who smoked only a few times in their life, do they still need a CT scan for screening? The answer is no. It is recommended only for those who are above 50 years and who were heavy smokers, like 15 to 20 years or more of smoking. A low-dose CT scan is repeated yearly. Remember, this does not mean that if you smoke lightly, you cannot get lung cancer. It just means that the test is only beneficial in heavy smokers. If you smoke, the best way to prevent lung cancer is to quit smoking today. Now we will see what are some of those screening tests which are not meant for everyone but for specific group of people. Prostate is a gland which sits beneath the urinary bladder, and prostatic cancer is one of the commonest cancers among men. On the internet, you will find many websites that claim a prostate cancer can be diagnosed easily using a blood test called the PSA test. And in clinic, we come across many young men who come with a report of higher PSA than normal. Is it cancer? So what is PSA? PSA, or the prostate specific antigen, is a chemical that is secreted by the cells of the prostate gland. Just an elevated PSA alone, especially in young men, does not mean cancer. Because there could be many reasons for an elevated PSA, like urinary infection, vigorous exercise, or even recent sexual activity. The American Cancer Society suggests that from age 45 to 50, you can consider getting a PSA done after discussing with your provider. If your PSA comes elevated, it should be followed by a digital rectal examination, where the doctor looks for any hard lumps in the prostate gland. And if he does find something, then he sends you for a scan followed by a biopsy. Esophagus, or the food pipe, is a tube that connects your mouth and the stomach. We all know that we have acid in our stomach to digest food. Acid is supposed to stay within the stomach, and there is a valve which stops it from coming upwards to the food pipe. The food pipe is not designed to handle the acid. Due to various reasons, some people develop acid reflux, commonly called the acidity, where the acid keeps flowing back into the food pipe. If you have it for a very long time, the food pipe gets irritated and can lead to a cancer. In such patients, we can diagnose a food pipe or stomach cancer early by doing endoscopies. Again, it is not for everyone. Your doctor will check if you are at a higher risk for cancer and advise you if regular endoscopies are needed or not. Especially in countries where tobacco chewing is common, oral cavity cancers are common. Quite often, before these cancers develop, there may be some early signs inside the mouth. While it is not mandatory for everyone, people who were tobacco users are recommended to get their mouths examined by a doctor to look for these early warning signs. Melanoma is a type of skin cancer. It develops from melanocytes, the cells that produce melanin, which gives us the skin color. Melanin does a very important function, that is to block the UV radiation from the sun. Melanomas are particularly common in people with a fair complexion whose melanin content in the skin is low, especially if they are living in an area where the UV radiation exposure is higher. In such people, a yearly skin examination is recommended. You can even do it yourself too. Watch for new moles that are changing in appearance, especially that are growing fast or with uneven borders or multiple colors. If you find any of that, then you should alert your doctor, who will again send you for a biopsy. Liver cancer is a cancer which progresses very fast and has limited treatment options. There are some people who are at a higher risk of developing liver cancer due to a condition called chronic liver disease or liver cirrhosis. Could be due to many factors like viral infections like hepatitis B or C, could be due to chronic alcohol consumption, long-standing fatty liver, or some inherited conditions. So if you have chronic liver disease, your doctor might recommend an ultrasound scan every 6 months along with a blood test called the alpha fetoprotein AFP. Again, it is not for everyone, only for those who are at a high risk of developing liver cancer. Now let us talk about some blood tests that are often misunderstood. These may be useful in certain situations but not recommended for routine cancer screening. CA-125 is a chemical that may be elevated in some forms of ovarian cancer. CEA is a chemical which may rise in certain patients with colorectal cancer. And CA-199 is a chemical which rises in certain forms of pancreatic and biliary tract cancer. We cannot use these tests to diagnose an early cancer of these organs. Why? Because they are very non-specific and there may be many reasons why they go up. So if you get a positive result, that does not mean you actually have cancer. Early detection saves lives, but not every test is necessary for everyone. So what are the must-do cancer screening tests? And these are based on strong evidence. Breast cancer, mammogram, starting at 40 to 50 years and to be done every 2 to 3 years. Cervical cancer, a pap smear or an HPV test, starting at 25 years of age to be done every 3 to 5 years. Colorectal cancer, colonoscopy, starting at 45 years and to be done every 10 years. Lung cancer, low-dose CT scan for heavy smokers, especially those who are above 50 years, and to be done yearly. What are optional screening? These are for people who are at a higher risk of developing cancer and it has to be discussed with your doctor first. Prostate cancer, the PSA test, consider after 45 to 50 years of age. Stomach and esophageal cancer, we have endoscopy for high-risk individuals. Oral cavity cancer, regular mouth examination for tobacco users. Skin cancer, melanoma, self-checks and doctor examinations for patients who are at a higher risk. Liver cancer, ultrasound and an alpha fetoprotein AFP test for those with chronic liver disease. Tests that are not recommended for routine screening: CA-125 for ovarian cancer, CEA for colon cancer, CA-199 for pancreatic and biliary tract cancer. These blood tests are unreliable for an early cancer detection. So what is the final takeaway? Stick to evidence-based screening tests. Know your personal and family history and alert your doctor. Avoid unnecessary tests that create anxiety. And that brings us to the end of the video. I know it was very long and extensive. Thank you so much for staying till the end. Please go back and watch again if some sections are not clear, and if you still have doubts or questions, please put them in the comment section and I will surely answer them. If you found this video helpful, hit that like button, share it with your family and friends, and subscribe for more medical content. Stay healthy and see you soon.